Dear medicos, welcome to Indian Anatomist. People who want to become doctors are free to check out the YouTube channel, Indian Anatomist. Today's topic is mediastinum. The mediastinum is the central compartment of the thoracic cavity, situated between the pulmonary or pleural cavities of right and left side. As we all know, that the pulmonary cavities contains the respective lungs. On the other hand, the mediastinum is present between the two lungs. The mediastinum is comprised of a number of distinct tissues, such as the heart, major blood arteries like the aorta and the vena cava, the thymus gland, the trachea, the esophagus, and in addition to a variety of nerves, and lymph nodes and lymph vessels or lymphatics. Now coming to the boundaries of mediastinum. 1. Anteriorly, the mediastinum is related to sternum. 2. Posteriorly related to vertebral column from 1st thoracic vertebra to 12th thoracic vertebra. 3. Superiorly, it is related to thoracic inlet. And 4. Inferiorly, related to the diaphragm. Now, what is thoracic inlet? The thoracic inlet is also called as superior aperture of thorax. Now, what are the boundaries of thoracic inlet? Anteriorly, bounded by superior border of manubrium sternum, or suprasternal or jugular notch. Posteriorly, bounded by upper border of body of 1st thoracic vertebra. And on either side, the aperture is limited by inner border of 1st rib. The superior aperture of thorax is an important pathway, through which many structures, passing from thorax to neck, and vice versa. This aperture is roughly kidney-shaped. It lies in oblique transverse plane that passes through antero-inferior to postero-superior direction. It is roughly 10 cm and 5 cm in transverse and antero-posterior dimensions, respectively. Now, what are the structures passing through this inlet? They are: in the midline inlet of thorax, transmits 1. Sternohyoid and sternothyroid muscles of both sides. 2. Thymus gland. It is an inconstant structure, because, after puberty, the thymus undergoes gradual involution, and is largely replaced by fat. 3. Inferior thyroid veins. 4. Trachea. 5. Left recurrent laryngeal nerve at trachea esophageal groove. 6. Thoracic duct. 7. Longus colli muscles. And number 8 is anterior longitudinal ligament of vertebral column. Now coming to structures present on either side, are 1. Simpson's fascia. And 2. Internal thoracic artery. Structures present from right side to left are 1. Sympathetic chain or trunk. 2. Superior intercostal vessels. 3. Anterior or ventral primary ramus of 1st thoracic spinal nerve. Now the structures present only on right side are 1. Brachiocephalic vein. 2. Phrenic nerve. 3. Brachiocephalic trunk. And 4th is vagus nerve. Now on the left side structures are 1. Brachiocephalic vein. 2. Phrenic nerve. 3. Common carotid and subclavian arteries. And finally, 4 is vagus nerve. Dear students, hope you all understood about the inlet of thorax or superior aperture of thorax. It represents an important anatomic landmark, serving as the central conducting pathway for many vital structures, extending from the neck into the chest and vice versa. Dear students, now coming back to mediastinum. The mediastinum is further divided into superior and inferior mediastinum by an imaginary transverse thoracic plane that passes in front or anteriorly at sternal angle, and posteriorly at intervertebral disc between 4th and 5th thoracic vertebrae. Now, what is superior mediastinum? The superior mediastinum is a wedge-shaped compartment of the mediastinum that is located between the superior thoracic inlet, above, and the transverse thoracic plane, below. Now, what is superior mediastinum? The superior mediastinum is a wedge-shaped compartment of the mediastinum that is located between the superior thoracic inlet, above, and the transverse thoracic plane, below. Boundaries of superior mediastinum. Anteriorly by manubrium sternum. Posteriorly by upper 4 thoracic vertebra. Superiorly, it is limited by inlet of thorax or superior aperture of thorax. And inferiorly, by an imaginary plane, the transverse thoracic plane, that passes through the sternal angle in front, and lower border of 4th thoracic vertebra or intervertebral disc between T4 and T5 vertebra, behind. And on either side or laterally, is limited by mediastinal pleura. Now, let us explore the contents of superior mediastinum. This is in order, from anterior to posterior are 1. Right and left, sternohyoid and sternothyroid muscles. 2. Thymus, not seen in adult individuals, instead it is replaced by fibrofatty tissue. 3. Right and left brachiocephalic veins, that joins to form superior vena cava. 4. Right and left phrenic nerves, and pericardiaco-phrenic vessels. 5. Arch of aorta with its 3 branches, that is from right to left are brachiocephalic trunk, left common carotid artery, and left subclavian artery. Number 6 is right and left vagus nerves, the right vagus nerve situated between the arch of aorta and trachea, whereas the left vagus nerve lies in front of arch of aorta, on left side. 7. Trachea and its bifurcation into right and left principal bronchus. See in the picture, these tubes are situated behind the brachiocephalic veins, and arch of aorta. 8. Left recurrent laryngeal nerve, is located in trachea esophageal groove of left side. 9. Trachea bronchial and paratracheal group of lymph nodes. 10. Esophagus, situated at the midline. Number 10 is esophagus, situated at the midline. And finally 11th is thoracic duct, which lies left, posterolateral to esophagus. Applied anatomy of superior mediastinum. Greetings students, I hope you all have comprehended the overall orientation of the mediastinum, as well as the superior mediastinum. Now, I'm taking you to the inferior mediastinum. Inferior mediastinum is further divided into anterior, middle, and posterior mediastinum. Dear students, before going to the subdivisions of inferior mediastinum, let us discuss the general boundaries of inferior mediastinum. 1. Anteriorly, it is bounded by body and xiphoid process of sternum. 2. Posteriorly by the bodies of lower 8 thoracic vertebrae, that is, T5 to T12 vertebra. 3. Superiorly, related to transverse thoracic plane. 4. Inferiorly by diaphragm, and 5th, on either side by mediastinal pleura, related to the mediastinal surface of corresponding lungs. As I already said, the inferior mediastinum is further split into anterior, middle, and posterior mediastinum. Now, I'll start by talking about the anterior mediastinum. Of all the mediastinums, the anterior mediastinum is the smallest. Boundaries of anterior mediastinum are anteriorly, bounded by body and xiphoid process of sternum. Posteriorly by anterior wall of pericardium. Superiorly by transverse thoracic plane. Inferiorly by diaphragm. And, on either side by mediastinal pleura. Coming to the contents of anterior mediastinum. The anterior mediastinum does not contain important structures, except 1. Lower part of thymus gland. As the thymus gland is only seen in children and not in adults. 2. Some mediastinal group of lymph nodes. 3. Mediastinal branches of internal thoracic artery, these are seen on right and left sides, behind the sternum. And 4. There are 2 flexible ligaments, the superior and inferior sternopericardial ligaments, that connect the anterior wall of the pericardium to the sternum. These ligaments keeps the pericardium and heart in position, thus, the anterior mediastinum is complete. Later in heart lecture, the middle mediastinum or pericardial cavity will be taken. Dear students, the anterior mediastinum is done. Hope everyone understood. Leave questions in comment box. Dear students, hope you all enjoyed this session. Good day all.